archive. If not, okay, that's been recorded now. So thanks everyone for joining today. It's a great pleasure to have Janet Scott from SCTCI, who is going to be talking about the IPAACKS. Just out of interest, how many people who are attending today have heard of IPAACKS? Maybe just click on the little icon, put your hand up if you have, or even if you've used IPAACKS as well, to give us an indication of who's maybe had some experience of IPAACKS. Okay, Jennifer, thanks. And maybe who is going to be completely new to IPAACKS as well? That'd be quite interesting to see. Okay, we'll maybe see that as we go through. So what we'll do is we'll just change over the screen and just say, hello, Janet, thanks for coming today. And I know that IPAACKS is a great resource. It's certainly used across Scotland. So what we'll do is I'll just switch, just to mention that these are clickable links as well. So if you want to download any of the files that are here, or you want to look at some external links, those links are there as well, okay? So I think we'll make a start now. That's 4 o'clock, and we'll just hand over to Janet. Okay, thanks, Janet, and we'll load your presentation. And there we go. I think we just use the right hand button.
Okay.
Okay, thanks. Okay, thank you, Janet.
That's fine. Well, many of you, or some of you anyway, will remember the Scottish Government Right to Speak report that was published in 2012 and the various pieces of work that followed on from that. The aim of the Right to Speak initiative was to ensure that people who use AAC, augmentative and alternative communication, can be fully included in society, have equal access to AAC services, and get access to AAC equipment when they need it. One of the pieces of work that was commissioned by NHS Education for Scotland, or NES, was this IPAACKS, which is a tool to help those of us working with and supporting children, young people and adults who use AAC. The purpose of IPAACKS is to help us identify what we need to know about AAC in order to do our job. It helps us to know what we already know and what skills we have and what skills we might need to develop. I'd like to thank Call Scotland for hosting this webinar and for giving me the opportunity to tell you a bit more about IPAACKS. It's really very timely with next month's commencement of the new legislation in Scotland around the provision of communication equipment and support for people to use that equipment. And just a little bit about me and why I'm talking to you about IPAACKS. As Craig said, I am a speech and language therapist. I work in SCTCI, which is the AAC assessment service based in Glasgow and providing a service across 11 of the 14 health boards in Scotland. During the Right to Speak project, I was asked by NES to work with them to produce this document. Oh, sorry.
Okay. There we go.
Right, okay. So the aim of this webinar is to explain a wee bit about what IPAACKS is, to talk through the different elements of the framework so that you can decide whether or not this could be something that might be useful for you in your particular setting. So what is it and where can you get hold of it? It's an online resource, an interactive PDF, and the links are on the screen or were on the screen. Some people may also have printed copies, but these are in fairly limited supply. It's available to download from the short URL shown on the screen. However, I usually just Google NES and IPAACKS and up it comes. The development of IPAACKS was funded by NES and its use has been endorsed by a number of different organisations. The main part of the document is a description of the underpinning values and commitments and the knowledge and skills required for anyone supporting an individual using AAC. IPAACKS is not a training course in AAC. It will help you to identify what you might need to learn, but doesn't necessarily teach you anything about AAC itself. It's a tool for you to use to reflect on your work and your role in relation to people who are using AAC. It's been mapped onto professional or sector CPD frameworks, for instance, the professional standards for teachers in education in Scotland. And it was the first national comprehensive guidance about what knowledge and skills are required of the workforce to deliver an efficient, effective and quality service to people who use AAC. So you might still be wondering, is IPAACKS for me? Although commissioned by NES, IPAACKS is really aimed for all workers in health, education, social work, social care, independent service providers, etc., reflecting the fact that AAC is not just a health responsibility. AAC itself covers a wide range of methods, equipment and techniques that people can use to support their communication. So, if you're working with a young person using a signing system such as Makaton or Sign-Along, you may find parts of IPAACKS relevant. If you're supporting a pupil who's using a high-tech electronic communication aid, then IPAACKS may be helpful to you. If you're working with someone who's using a low-tech communication aid, such as a communication book, or PECS, or a pod book, then you might find parts of IPAACKS applicable to you. It was primarily written from the perspective of an individual worker, and as an individual worker or as an individual person, you could use IPAACKS as the basis for a discussion of your AAC learning and development needs with your line manager. You could use it to provide evidence for your CPD review or appraisal, using whatever framework is appropriate. However, IPAACKS can also work really well if it's used from a team perspective, identifying the strengths and skills within a team, as well as any gaps or weaker areas. IPAACKS is based on improving the quality of life and communication outcomes for people who use AAC. These are just some of the examples of the service user focused outcomes. IPAACKS helps us to look at what we need to know and what we need to be able to do to achieve these outcomes for our service users, whether these be pupils in a school, a young preschool child, an older person who's had a stroke, anyone who may be using AAC to support their communication. IPAACKS promotes values-based practice, enhancing communication, and it provides a focus for self-reflection. It helps us to identify how confident we feel in our ability to, for example, really promote inclusion and participation for people who use AAC. That's easy to say and maybe difficult to do. IPAACKS also helps you to reflect on your AAC-specific knowledge and skills and what you need for your role. There are 8 specific strands of AAC knowledge and skill, and someone described this as breaking AAC down into bite-sized, manageable pieces. The first 4 of these strands reflects the journey someone might have and typically represent the kind of face-to-face work that we might do supporting people who use AAC. The person has a communication need recognised and identified. Their needs are assessed. They have support to learn to communicate using AAC, someone working with them to help them learn to use their AAC system. People change, their needs and abilities will change, their environment might have changed. The AAC system may no longer meet their needs. There needs to be some sort of review mechanism built in. But we all know that developing someone's communication, working in AAC, is not all about the face-to-face stuff. There's a lot of knowledge and skill required in the background, in knowing how to make up low-tech resources, program high-tech communication aids, how to look after this sort of equipment, how to integrate various aspects of technology, how to help others learn about AAC. It's worthwhile looking at each of the strands. You might not feel that you are, for instance, involved in AAC leadership or management of resources, but you might find that you are to some extent. Each of the AAC-specific strands is divided into 4 different levels, reflecting the fact that people need different levels of knowledge and skill depending on their role. IPAACKS recognises and supports the reality that people have different strengths, that people have different roles within each of the teams we work in. We don't all need to be experts, but we all should be able to work to the level required of our role. One of the main parts about IPAACKS is the assessment element, and there are 4 steps to the self-assessment or to the team assessment. Some people find it helpful to print off either the assessment section or the knowledge and skills descriptors to save toggling backwards and forwards through the document on the screen. It certainly helps to save the document before you start entering any information into it. You might also want to print off your completed assessment for future reference. I'm going to talk you through each of the 4 steps of the assessment quite quickly. So the first step is really to think about your role in relation to the person who uses AAC. What do you need to be able to do to support and develop their communication through AAC? Which of these 8 AAC knowledge and skills strands are key to your role? An AAC strand is key to your role if it's something that you do whenever you're working with people who use AAC. You don't need to be doing it every day. If you're using the IPAACKS format, this is a chance for you to clearly indicate what are key skills and competencies that you require for your role. The underpinning values and commitments are key for all of us, regardless of our role and our job title. At this stage, the second stage in the assessment, you're simply identifying the levels required for your role, not whether you actually have that level of knowledge and skill. You might want to focus only on those AAC strands you've already identified as being key. You also don't have to do everything in a particular level for that still to be the appropriate level for your role. Particularly in AAC, people may require different levels of knowledge and skill for each of the different strands, as you can see from the pie charts on the screen. Some people may not require any specific knowledge and skill in a particular strand. At this third stage of the assessment, you're beginning to weigh up whether or not you feel you have the required level of competence. This is the level that you've already identified as being required for your role. Again, focus on each of the individual strands of AAC specific knowledge and skill and the core values and commitments. You may feel that you need to have a particular level of expertise, but you're not sure if you actually have it. You may feel quite confident that you do have the level of knowledge and skill required for a particular aspect of AAC. There's obviously always scope for learning and developing, but it's also okay to say that you feel quite confident in knowing what you're doing. For instance, in relation to making up a communication book, which is an aspect of the technology, preparation, adaptation and integration strand. What you might not feel quite so confident perhaps is in how to introduce that communication book and really help people to use it, which is part of the implementation strand. Don't worry too much about this rating scale. It's really just to give you an overview or a snapshot of your relative areas of strength across different aspects of AAC competency. The AAC specific strand section of this table is left blank on purpose so that you can write in the specific strands you're focusing on. You may wish to rate your levels of competence across all 8 strands, but if your role is really limited to 1 or 2 of the areas, then that is all you need to focus on here. So now you've found, hopefully, that there are some aspects of AAC that you feel fairly confident in, that you feel that you are role ready. There may be other areas where you would like to feel more confident in. Hopefully IPAACKS will have helped you to identify this and to pinpoint those areas where there is a learning need. What specifically do you need to learn or be able to do? What would make you feel more confident in your capabilities? So this slide shows an example of a knowledge skill confidence gap. and is an example of how IPAACKS could work. Looking at the competency wheel, or the pie, completed by this worker, they need a range of different levels of knowledge and skills. The biggest gap between the level of knowledge and skills needed and this worker's level of confidence is in facilitating AAC learning, helping other people to learn about AAC. They've got the sad face. This is then followed by implementation, working with someone to improve their communication using AAC. So what might help this worker feel more confident in helping other people learn about AAC might be to find out how to train other people in AAC, to go on a specific training course, e.g. a Makaton Tutors course, or perhaps to learn more about AAC itself so that they feel more confident in being able to talk about AAC to other people. Obviously, learning more about AAC and upskilling yourself on AAC techniques will not be your only CPD objective. It's important to tie this in with your other objectives. However, IPAACKS can be a useful tool to evidence an ability that you have developed. It's designed to be used alongside your professional development review process. And there are lots of resources for learning about AAC available online, and some of these are on the webinar page. IPAACKS was the first document of its kind which tried to describe the knowledge and skills required for all potential workers working with anyone who uses AAC across all sectors and across all ages and abilities of people. Inevitably, it will be too superficial in parts. Some descriptions may not really fit with what you do. So use the parts of IPAACKS that are relevant to your individual situation and adapt or leave out those descriptions that do not really match what you do or what you need. IPAACKS has been available for some time now. Initially, when it was being developed, it was thought that IPAACKS would be a tool used by individual workers. And it certainly seems to be useful as such, both in identifying learning needs and skill gaps, but also in affirming existing capabilities. Some people have felt that it really raised the profile of people who use AAC within their service. Others felt that it helped to break down AAC into bite-sized pieces, helping them to identify which specific areas of knowledge or skill they needed to develop at a particular time. Some people felt that it was almost more useful when done in a group, and that it was actually very beneficial if people were at different levels within the organisation or had different jobs. It helped people to see where they fit in the bigger picture, and that their role is equally as important in supporting the person at the centre who uses AAC. So this is an example from 3 local authorities' education departments within Forth Valley, who developed a really useful set of resources called the Right to Speak Schools Pack. This work linked IPAACKS Knowledge and Skills profile and the GTCS Professional Standards for Teachers. Different roles were identified within education, each with their own minimum standards of AAC knowledge and skill. So, for example, a mainstream school with a pupil using AAC would expect certain levels of competency for the class teacher and pupil support assistant, who would then be additionally supported by external specialists, for example, the complex needs outreach teacher and/or the ICT and inclusion teacher, etc. So I think we've maybe got time for a short video clip of 2 teachers and a speech and language therapist talking about how they've used IPAACKS.
Okay, I'm David Fletcher. I'm an additional support needs teacher from Stirling Council.
Jennifer Craig, I'm a Deputy Head Teacher at Willowbank School in East Ayrshire.
My name is Nikki Ford. I'm a speech and language therapist. I work for NHS Lothian.
We then took it forward in the school as part of a kind of major agenda for an improvement plan for this year, which had a kind of total communication kind of focus. We then rolled it out for all of our staff, classroom assistants and teaching staff and instructor staff, and everybody has completed their, a self-assessment. What we're hoping to then take forward, having done quite a lot of development within the school and training, we're hoping then to take it forward to then re-evaluate and see how much our skills have developed.
Oh, great. So it sounds like you're a bit further on down along the line of using it with all of your
Absolutely.
staff.
I think what we would like to do as well is to roll it out to catering staff, office staff, janitorial staff. That's the next step for us, and try and get the whole school, because we really very much this focus of total communication throughout the school, and obviously everybody plays a part in that. So I think IPAACKS could be a great way to start the skills level, and then hopefully that will build and we'll reassess and see if the skill level has improved or people feel more confident. Certainly that would be a great start.
That sounds fantastic. I think from just our pilots with 2 class teams, it's been so useful for identifying next steps for developing the staff knowledge and skills. There was one staff member who hadn't realised, wasn't feeling very confident just with the general concept of total communication and AAC, so she's coming again on our induction training, and another staff member was feeling very confident and competent in all of the areas that she needed, so she's actually taking more of a role in developing AAC across the school, and she's taking a bigger part in sort of target setting for the children in her class. So
I suppose that's similar to the AAC champions that we've kind of established with kind of training days. We are very lucky to have an AAC lead within East Ayrshire. So Linda has taken that forward and trained a classroom teacher and a classroom assistant, 3 separate sessions, and has kind of involved them in a very specialised, very intense training programme, which has taken them through low-tech aids right to high-tech aids, and obviously within the school we have quite a lot of IGs, technology and everything, so that's trained up a member of staff for the primary and a member of staff for the secondary, and that's taken things forward again, and it would be good to look at their skills base now and see how that's raised, which I imagine it will have.
great. Yeah, that's really good.
Well, we've done something similar in terms of trying to encourage schools to appoint a communication champion along the same ideas, who will take an interest in AAC and can help to mentor other members of staff. So I think it's a really good approach to use.
And I think also if you're in a school with a core team, you've got a young person with a communication difficulty, perhaps in a mainstream setting, it's getting janitorial staff, catering staff, office staff to buy into it as well, to understand that they have a role to play as well, and how valuable that is to make this young person be included in the environment and be able to communicate in the environment. That's what I found that has been invaluable for us, and how it's now all kind of permeated through our catering staff who are desperate to go on Makaton courses now and are all involved in our training, which hadn't happened previously, and we feel that that's made a big difference.
Also for staff, because sometimes in the smaller local authorities it's maybe one member of staff who can be really highly experienced in supporting schools and young people using AAC and other technological aids, and they can retire or get another job next door or become ill or something, and so you don't want the children, young people or adults even being affected by the unavailability of one person. And so because it's actually quite a specific way of upskilling people to do particular things, if it's broadening the range of people who are able to support a particular need for an AAC user, that can only be good.
Thanks, Janet, for that. Sorry about the lip sync problems we had there. That's one of the disadvantages of showing video online, but I think you got the message over. It was great to hear the story about catering staff wanting to learn about Makaton training and things. So this is an opportunity for you to ask Janet any questions. I was going to actually ask you, Janet, and this is because we've got some folk here who are out with Scotland. IPAACKS just purely isn't for Scotland, is it? It can be used across a variety of areas, you know.
No, obviously my context is working in Scotland, so a lot of the terminology is Scottish based, I guess. But certainly I know that colleagues in England and Wales and I think Northern Ireland have been using IPAACKS. I'm not sure whether it's gone further afield than the UK, but I think it's not something that I feel you have to use in its entirety. I think it's a bit like a pick and mix counter in a sweetie shop. use the bits that work for you and ignore the bits that don't work for you.
Yeah, so presumably, I'm thinking about Christine, for example, and Leanne from Cork.
Yeah.
Is it something that they would maybe they could think about, but keep the back of the mind about the context in which it was written? Yeah.
I would have thought so, because people who use AAC or people who need AAC are the same the world over, and their communication needs are the same. So there's obviously an element of translation would need to happen, but I don't think it would be impossible.
Yeah.
Christine or Leanne, good luck.
So, do you have any more questions before we finish up? Just to remind you that if you wanted to download the IPAACKS, here it is here. Okay, this is the one you can
The
get.
information sheet.
Yeah.
And then that's the actual.
And the actual one here. Okay. Yeah. And some of the links that Janet talked about are also here. These are all sort of clickable links.
Yeah. The Barnsley one, the Barnsley Assistive Technology Competency Framework and the Technology to Care Framework, they're knowledge and skills frameworks that have got some overlap around AAC. Certainly the Barnsley one does, but they're just quite useful competency frameworks that may be relevant for you.
Yeah.
And the other websites, I think, are more ones that have got links for finding out more about AAC and AAC courses and things like that.
Yes. Okay, great. So Gillian's typing a question. Yes, she's. Can you explain a little more about links to the professional and the prof and sector specific framework?
The professional sector specific frameworks. Certainly. They have the IPAACKS knowledge and skills levels have been linked to different competencies within the knowledge and skills framework, which is an NHS competency CPD tool. It's been linked to the professional standards for teachers in education in Scotland. That's one area that would definitely need to be changed. It's been linked to the social services and healthcare, the national occupational standards, and I think that's the three main ones that it's been linked to. So the idea would be that if you were working on a particular aspect, or if you had an objective maybe around improving communication skills, then you could look to see if there was something in IPAACKS that you could use as evidence for your professional review.
Okay, thank you, Janet. Hope that answers your question, Julian. I think we'll close the session now, and just to say thanks to everyone for attending, and thanks to Janet, who travelled from Glasgow today to come over to Edinburgh to do this presentation. Although you could have probably done it from Glasgow when we think about it. Yeah.
No, it was much nicer to come through to Edinburgh, all the huge distance.
Okay, well, thanks everyone, and just remember, just to remind you, this will be an archive on the COL websites. Just look under the training tab and look at the archives under webinars on the right hand side. Okay. It's normally ready the next day, so hopefully tomorrow sometime it'll be ready if you want to pass it on to any friends. So thanks everyone. Okay, thanks, bye.